right, so as always, thank you for now. Up next, I have our Kim Yeon-seung in the studio with the latest government remarks on the local COVID-19 situation. Yeon-seung, welcome back.
Good to be here, Sunny.
Right, so as I mentioned, Korea's COVID-19 tallies appear to be on the rise. Is Omicron driving these numbers up then?
Yes, exactly. So Omicron does seem to be the latest driver of cases. But authorities expect the numbers to go high, even higher, as Omicron is becoming the dominant strain across the nation, especially in areas outside the capital region. Take a listen.
The Omicron spread is accelerating. 1 in 4 new cases are Omicron. The rate of infections is steeply rising in Jeolla-do, Gyeongsangbuk-do and Gangwon-do provinces.
In the Jeolla-do provinces, Omicron already makes up close to 60% of the cases and has replaced Delta as the dominant strain. In Gyeongsangbuk-do province, Omicron consists 37% of the cases, and in Gangwon-do 31%. In the capital region, Omicron makes up a little less than 20% of the infections, so it is a little low, but authorities expect the spread to accelerate in the coming days.
During the 3 weeks of extended social distancing, including the Seollal holiday, 80 to 90% of cases would become Omicron. We see that an increase in infected cases would inevitably follow.
In response, officials are preparing a shift in their current prevention strategy into one that's more tailored to Omicron. And if and when daily cases top 7,000, the government will start its transition to this Omicron-targeted system.
Right, Yeon-seung, now do tell us a bit more about this particular strategy against Omicron.
Right, so the strategy will mainly focus on speed and efficiency. It will speed up contact tracing, strengthen quarantine for arrivals, bolster our medical capacity, broaden the use of COVID-19 pills, and mobilize local clinics for testing and treatment. Health authorities are also allocating their limited medical resources in a more selective and efficient way. For example, before, all Omicron patients used to receive care at residential treatment centers, even if they had mild to no symptoms, because health authorities wanted to curb the spread of Omicron by keeping them isolated from the general public. But now that Omicron is already widespread in the community, and because it has been linked to milder illnesses, health authorities now believe that it's more appropriate for Omicron patients to be treated at home. Take a listen to what a senior top health official had to say today.
From today, we are treating Omicron-infected patients at home. And to select and focus our efforts, our residential treatment centers will first give room to high-risk elderly and those with underlying disease.
Right, that was Song Young-lee then. And I understand Prime Minister Kim Buk-yeon, for his part, also touched upon further changes to our vaccine pass system. Yeon-seung, tell us more.
Exactly. So while health authorities are sharpening their edges in the prevention response, they're also loosening their grip on vaccine passes. The Prime Minister said that they plan to enforce vaccine passes in a more flexible way that minimizes confusion and inconvenience. One change that they will be making is broadening vaccine pass exemptions for those who have been hospitalized due to side effects after getting their first vaccine dose. Further tweaks to the vaccine pass rules will be announced on Thursday.
Right, and you'll probably have updates on that. Yeon-seung, regardless of these exemptions, though, I understand authorities remain in strong support for vaccinations, of course, right?
Of course, and I'm glad you brought it up because senior officials in South Korea today also mentioned the importance of getting vaccinated. In fact, Prime Minister Kim and senior health official Son Young-nae on Wednesday repeatedly stressed the importance of getting the booster shots, especially when defending against Omicron. Take a listen.
We need to speed up our third shots. The more we delay it, the more vulnerable we may become to the threat of Omicron.
Health authorities say that while almost 84% of those aged 60 or over have gotten their boosters, 31% of people in their 20s to 30s and only around 27% of foreigners have gotten their top-up shots. According to authorities, groups that have a low rate of vaccinations have also been seeing high rates of infections.
Confirmed patients among foreigners started rising since the 4th week of December and now makes up around 14% of the total infections. We believe it's because of their low rate of vaccinations, especially with their third shots.
Right, which is why we're encouraging them to get their booster shots here. All right, Yeon-seung, thank you for that update. I'll see you back on Thursday.